Good day, everyone. I am Lillian Canyon, and today I will be presenting about ankylosing spondylitis. I hope you'll be able to learn from this video. Ankylosing spondylitis is an inflammatory condition mainly affecting the spine that causes progressive stiffness and pain. It is part of the seronegative spondyloarthropathy group of conditions relating to the HLA-B27 gene, and other conditions in this group are reactive arthritis and psoriatic arthritis. The key joints that are affected in ankylosing spondylitis are the sacroiliac joints and the joints of the vertebral column. The inflammation causes pain and stiffness in these joints and can cause progress of fusion of the spine and sacroiliac joints. Fusion of the spine leads to the classical bamboo spine finding on spinal X-ray that often appears in medical exams. There is a strong link with the HLA-B27 gene. Around 90% of patients with ankylosing spondylitis have the HLA-B27 gene. However, around 2% of people with the gene will get ankylosing spondylitis. This number is higher, around 20%, if they have a first-degree relative that is affected. The main presenting features are lower back pain and stiffness and sacroiliac pain in buttock region. The pain and stiffness is worse with rest and improves with movement. The pain is worse at night and in the morning and may wake them up from sleep. And it takes at least 30 minutes of the stiffness to improve in the morning, and it gets progressively better with activity throughout the day. Symptoms can fluctuate with flares of worsening symptoms and other periods where symptoms improved. Vertebral fractures are a key complication of ES. Ankylosing spondylitis does not only affect the spine, but can also affect other organ systems, causing systemic symptoms such as weight loss and fatigue, chest pain related to costovertebral and costoesternal joints, enthesitis, where tendons or ligaments inserts into the bone, which can cause problems such as plantar fasciitis and Achilles tendonitis. Dactylitis is an inflammation in a finger or toe, anemia, and anterior uveitis. Inflammation of the aorta. Heart block can be caused by fibrosis of the heart's conductive system. Restrictive lung disease can be caused by restricted chest wall movement. Pulmonary fibrosis at the upper lobes of the lungs occurs in around 1% of ankylosing spondylitis patients, and inflammatory bowel disease is a condition associated with ankylosing spondylitis. Schubert's test is classically used to determine if there is a decrease in lumbar spine range of motion, most commonly as a result of ankylosing spondylitis. The measurement of this test is useful for screening the status of ankylosing spondylitis disease and determination of progression and therapeutic effects of ankylosing spondylitis and other pathologic conditions associated with lower back pain. Schubert's test is used as part of a general examination of the spine to assess how much mobility there is in the spine. First, have the patient stand straight and find the L5 vertebrae and mark a point 10 cm above and 5 cm below this point. Then, ask the patient to bend forward as far as they can and measure the distance between the points. If the distance with them bending forward is less than 20 cm, this indicates a restriction in lumbar movement and will help support a diagnosis of ankylosing spondylitis. Bamboo spine is a typical exam description of the X-ray appearance of the spine in later stage of ankylosing spondylitis. X-ray images in ankylosing spondylitis can show squaring of the vertebral bodies, subchondral sclerosis and erosions, syndesmophytes, are areas of bone growth where the ligaments insert into the bone. They occur related to the ligaments supporting the intervertebral joints. Ossification of the ligaments, discs, and NSAIDs can be used to help for pain. Steroids can be used during flares to control symptoms. This could be via oral, intramuscular slow-release injections, or joint injections. Anti-TNF medications such as etanercept or a monoclonal antibody against TNF such as infliximab, adalimumab, or certolizumab pegol are known to be effective in treating the disease activity in ankylosing spondylitis. Secukinumab is a monoclonal antibody against interleukin-17 and is recommended by NICE if the response to NSAIDs and TNF inhibitors are inadequate. Physiotherapy such as exercises and mobilization is recommended for patients having ankylosing spondylitis. Bisphosphonates to treat osteoporosis, treatment of complications, and also surgery is occasionally required for deformities to the spine or other joints. Thank you.